About 30 to 40% of people have this. How do you practically measure blood pressure at home? Practical tips for measuring blood pressure at home. I would say the best way of checking blood pressure is checking blood pressure at home. About 30% of people have got a blood pressure which is either low or high as compared to the clinic blood pressure. When people have higher blood pressure in the clinic than at home, we call it as white coat hypertension. When they've got a blood pressure which is lower in the clinic as compared to the home blood pressure, we call it as masked hypertension. So when I see somebody in the clinic, the chance that the blood pressure measured in the clinic is the same as what they've got at home is only about 60% or so. The rest 40%, it's not the same as what it's in the clinic. So it's always better to measure blood pressure at home and keep a record. If you're somebody who's got a well-controlled hypertension, you don't have to check every day. Probably have to check it a couple of times a week. But if you're somebody whose blood pressure is still not controlled, I would recommend that you check blood pressure every day, multiple times a day. Because as I've told before, blood pressure does vary during the day. And there's some tips as well to checking blood pressure. Always check it empty stomach, because after we eat food, increased blood supply to the intestines reduces the blood pressure. So always check blood pressure empty stomach or 2 hours after food. Do not consume caffeine or any drinks half an hour before. Do not smoke half an hour before. Do not smoke at all. But if you're somebody who's smoking, don't check blood pressure at least for half an hour after you've had a smoke. Empty your bladder, be relaxed, and sit in a position where your feet are resting on the floor comfortably and your back is rested to the chair. Your arm, your heart and the blood pressure monitor, all of them should be at the same level. You should be relaxed in an environment where it's quiet and calm. And you relax in that environment for a couple of minutes before you start the blood pressure recording. When it comes to the machine per se, use machines which are calibrated and which are of good quality. In India, unfortunately, the home machines, you cannot calibrate them. Our hospital machines, we get them calibrated every 6 months. Mostly, I've seen that a machine from a reputed brand will be valid for at least 3 to 4 years. But then I always ask my patients to bring their monitor a couple of times a year so I can check it, compare it along with my clinic monitor. So that's a validation in itself. So if the readings are similar, they'll not be exactly the same. If they're similar, I know that their BP monitor is reliable. Always use an arm cuff monitor, not a wrist monitor for checking blood pressure. When you put the cuff, so most home blood pressure monitors will have a cuff which is of a medium size. They do not give you multiple sizes, a medium size, and for the left arm so that you can use your right arm to open and close. And there will be a mark, a round or a triangle mark for the artery. You have to make sure that that comes on the inside of the arm here. The cuff should be a couple of fingers above the elbow crease, and then you should be able to put in 2 fingers inside the cuff comfortably once you have placed the cuff. The cuff will usually have a part which is the bladder, the inflatable part, the bladder. That should be covering at least 3/4 of the circumference of the arm. People who've got a larger arm will require a larger cuff. Otherwise, if you use the same medium-sized cuff, you will get false high readings. And the other way around is true as well. If somebody is very thin and we use a large cuff, they will get false lower readings. So use appropriate size cuff as well. Some companies like Omron do sell different size cuffs as well, which you can order separately. It doesn't come with the machine, but comes separately. Whenever you have to check the blood pressure, check it more than once. I always say what is standard is check it 3 times with about 2 to 3 minutes gap in between, because usually if the first reading is always high, the second and third are more reliable. And then take a average of the second and third reading and document it in a book or in an app or in your phone somewhere. So it's there for your doctor to see when he or she sees you in their clinic. Multiple readings are very important, and knowing the blood pressure, what the blood pressure is doing in the morning, afternoon, evening is very important for us to change the medicines as well. These are the tips to check the blood pressure at home. Make sure you consult your doctor with regards to how frequently you have to monitor the blood pressure, etc. Because I usually tell my patients, if it is controlled, you don't have to check it every day. We've also included a BP monitoring chart in the link below, and you can download it, print it out, and use it to record your blood pressures at home as well. Thank you very much.